my name is Andrea, and I am your lead clinical nurse educator for Southern California. And today we are going to talk about how to prep and administer Moderna. So, Moderna is an mRNA vaccine. This is milky in color. This is a 2-dose series separated by 28 days apart, and each dose is 0.5 mLs. Okay, expiration date. Let's talk about how to locate that. When you arrive to your shift in the morning, you will go into the refrigerator if you are the prep nurse or the charge nurse, and you're going to do your initial count, right? So, while doing your count, you're going to want to figure out what is your expiration date for your vaccine. Unfortunately, the expiration date is not located on the box or the vial itself. What you would have to do is use your cellular device and scan the QR code that is on the box itself. Once you scan the QR code on the box itself, your cellular device will then prompt you to plug in a lot number, and the lot number is located here. You would plug in that lot number and it would generate your expiration date for that box, and then you would go ahead and write that on the box itself. So we know that this whole box, this is what the expiration date is. If you were to have a second or third box, of course we would have to do that for every box in the morning and then write the expiration dates on here. Okay, let's talk about storage. Initially, your vaccine is stored in the freezer and then it is transported into the refrigerator. So initially, the vaccine is stored in the freezer from -50 degrees Celsius to -15 degrees Celsius. So in the freezer from -50 degrees Celsius to -15 degrees Celsius. Then it is transferred into the refrigerator. In the refrigerator, your vaccine can stay in there for up to 30 days between 2 to 8 degrees Celsius. This means no one has touched it. These vials have not been punctured. They have just simply been taken out of the freezer and placed into the refrigerator. Okay, let's talk about thawing our vaccine. When I say thaw your vaccine, I simply mean the vaccine coming from a solid to a liquid state. So, to thaw Moderna, for vials that contain 10 to 11 doses, what you're going to need to do is take your vaccine out of the freezer, place it into the refrigerator, and let it sit for 2.5 hours. After the 2.5 hours have passed, your vaccine should be at a liquid state. Alternatively, what you can do is you can take one vial and you can take it out of the freezer, you can let it sit at room temperature for 1 hour, and then your vaccine should come to a liquid state. When you're letting your vaccine sit at room temperature, still make sure that you are protecting it from any type of light. Also, say you come and show up to work in the morning, you go into the refrigerator, your vaccine is still frozen or partially frozen, then you would take that vaccine out of the refrigerator and then let it sit at room temperature for the 1 hour still and protect it from light. Okay, let's talk about thawing your vials that contain 13 to 15 doses. In order to thaw the vials that contain 13 to 15 doses, what you will need to do is you will take your vaccine out of the freezer and then you would place it in the refrigerator between 2 and 8 degrees Celsius and let them sit there for 3 hours. After the 3 hours has passed, your vaccine should come to a liquid state. Say you don't have 3 hours because you have an abundance of appointments or you have a line of people, what you would do to thaw for immediate use is take that vaccine out of the freezer, let it sit at room temperature for 1.5 hours, making sure that we are protecting it from any type of light. Say you show up in the morning, your vaccine is in the freezer, but it's still frozen or partially frozen. You can do the same steps. Take one vial out, let it sit at room temperature for the 1.5 hours for immediate use. Okay, let's talk about the steps we should take before we prep or administer Moderna. Moderna may not be administered cold, so what we need to do is take our vaccine out of the refrigerator, make sure it is in a liquid state, which this one is. Then we would let it sit at room temperature, protect it from sunlight for 15 minutes before we could begin to prep or administer the vaccine. All Moderna vaccines must come to room temperature before you can prep or administer them. Okay, let's talk about punctured versus unpunctured when at room temperature. Say you pulled your vaccine out of the refrigerator and it has been sitting at room temperature and you have not punctured it. There has not been a needle introduced to it. This vaccine can sit at room temperature for 24 hours. Once you puncture this vial, your vaccine is then only good for 12 hours. So after 12 hours, your vaccine would be considered expired. So for Moderna, once we take our first dose out of this vial, what we would want to do is get a Sharpie, and we're gonna go ahead and put the time and the date on the vial. Okay, let's talk about prepping Moderna. When you prep Moderna, you're going to want to make sure that your vaccine is not expired. So you'll go ahead and locate that expiration date and make sure that it is within the date. You'll pull your vaccine from the refrigerator and you're going to allow it to come to room temperature. So we're gonna let it sit for 15 minutes. Once your 15 minutes has passed, we wanna make sure that we are inspecting our vaccine. We wanna make sure that it is milky in color and that there are no particulates floating in your vaccine. Once you have done that, you've checked the expiration date, what you're going to do is you're going to give your vaccine a gentle swirl. So for Moderna, you swirl 2 to 3 times, very gently. Then you would take an alcohol wipe and you're going to go ahead and clean the stopper of your vaccine. Allow the stopper to dry. This vaccine has no preservatives in it, so we don't want to introduce alcohol into the vaccine itself. Then you will get your needle and you're going to draw back your dose, which for Moderna, each dose is 0.5 mLs. So we have 0.5 mLs of air. Draw back your dose while your cap is on, okay? Once you have your air in, you're going to introduce the air above the medication. That way we're not disturbing it. Then we're going to gently invert our vial and then we'll pull back our dose of 0.5. Once you have your dose, you're going to go ahead and stabilize your vial on the table again and pull your needle out. If you are the prep nurse, you will have to recap. So we're going to go ahead and use the one-handed scoop method for that. Make sure we're not contaminating our needle by touching any surfaces, okay? So we'll go ahead, scoop method. Make sure you hear the click and that the needle is on the syringe properly, so you will go ahead and give it a little twist. After you have your dose drawn up, you will go ahead and verify that you do in fact have 0.5 mLs, which I do, and we're going to verify that it is milky in color and that there is no particulates floating in it. Once you have verified that, then you would pass it off to the administering nurse. Okay, let's talk about administering Moderna. When you are the administering nurse, it is your job to make sure that your dose is correct. So when your dose arrives to you, make sure that you in fact do have that 0.5 mLs, your vaccine is milky in color, and that there are no particulates floating in it. Okay, so we verified that our dose is correct. We have screened our patient. Our patient is eligible to get the vaccine. Also, our patient has consented to getting the vaccine. For Moderna, we are going to give this vaccine IM, which is your deltoid muscle or your vastus lateralis. So how we're going to measure that is on the lateral side of your patient's arm. You're going to find the acromion process, and your deltoid muscle is 2 to 3 finger breaths below, and then this would be your vaccinating site, okay? So you would identify those sites with your patient. As a nurse, you want to use your best nursing judgment. So you can use the Z-track, you can use the pinch, you can spread the skin. We just want to make sure that we are, in fact, going IM. So from there, we'll get a clean alcohol wipe, and we're going to clean the patient's skin in a circular motion from inner to outer, okay? Allow it to air dry. Once it is air dry, you're gonna get your dose. And we're gonna use the DART method. Always hold here. Don't get in the habit of doing this, because then we're gonna go sub-Q, or we're gonna waste before we even vaccinate the patient. So go ahead, remove the cap from the needle. Use your best nursing judgment, whether you're going to pinch or spread. You're gonna insert at a 90-degree DART method. So 1, 2, 3, in. Insert your vaccine. Hold for 2 seconds, 1, 2. Pull out at a 90-degree angle. This needle is your first priority. So after you vaccinate your patient, go ahead and activate the safety. We always use a hard surface. Never use your finger to activate the safety. We just want to do that to prevent needle sticks. And then go ahead and drop your needle into your sharps container. If your patient is bleeding, you guys are supplied with gauze. You'll go ahead and you'll hold pressure. After that, then you'll go ahead and apply a Band-Aid to your patient. You're going to provide the vaccine record card along with the EUA fact sheet, and then you will send your patient over to the observation area.